Hi, I'm Ben. Today I will be walking you through high blood pressure, otherwise known as hypertension. In this video, we'll cover what hypertension is, as well as the symptoms, causes, risk factors, and complications. Let's start with what hypertension is. Hypertension is another name for high blood pressure, which is a common condition that affects the body's arteries. If you have high blood pressure, the force of the blood pushing against the artery walls is consistently too high. The heart has to work harder to pump blood. Blood pressure is measured in millimeters of mercury, mmHg. In general, hypertension is a blood pressure reading of 130/80 mmHg or higher. The American College of Cardiology and the American Heart Association divide blood pressure into four general categories. Ideal blood pressure is categorized as normal. Normal blood pressure is a blood pressure reading lower than 120/80 mmHg. Elevated blood pressure. The top number ranges from 120 to 129 mmHg, and the bottom number is below, not above, 80 mmHg. Stage 1 hypertension. The top number ranges from 130 to 139 mmHg, or the bottom number is between 80 and 89 mmHg. Stage 2 hypertension. The top number is 140 mmHg or higher, or the bottom number is 90 mmHg or higher. Blood pressure higher than 180/120 mmHg is considered a hypertensive emergency or crisis. Seek emergency medical help for anyone with these blood pressure numbers. Untreated high blood pressure increases the risk of heart attack, stroke, and other serious health problems. It's important to have your blood pressure checked at least every 2 years starting at age 18. Some people need more frequent checks. Next, let's cover the symptoms of hypertension. Most people with high blood pressure have no symptoms, even if blood pressure readings reach dangerously high levels. You can have high blood pressure for years without any symptoms. A few people with high blood pressure may have headaches, shortness of breath, and nosebleeds. However, these symptoms aren't specific. They usually don't occur until high blood pressure has reached a severe or life-threatening stage. The causes of high blood pressure are determined by two things: the amount of blood the heart pumps and how hard it is for the blood to move through the arteries. The more blood the heart pumps, and the narrower the arteries, the higher the blood pressure. Now, let's focus on the risk factors. High blood pressure has many risk factors, including age. The risk of high blood pressure increases with age. Until about age 64, high blood pressure is more common in men. Women are more likely to develop high blood pressure after age 65. Race. High blood pressure is particularly common among black people. It develops at an earlier age in black people than it does in white people. Family history. You're more likely to develop high blood pressure if you have a parent or sibling with the condition. Obesity or being overweight. Excess weight causes changes in the blood vessels, the kidneys, and other parts of the body. These changes often increase blood pressure. Being overweight or having obesity also raises the risk of heart disease and its risk factors, such as high cholesterol. Lack of exercise. Not exercising can cause weight gain. Increased weight raises the risk of high blood pressure. People who are inactive also tend to have higher heart rates. Tobacco use or vaping. Smoking, chewing tobacco, or vaping immediately raises blood pressure for a short while. Tobacco smoking injures blood vessel walls and speeds up the process of hardening of the arteries. If you smoke, ask your care provider for strategies to help you quit. Too much salt. A lot of salt, also called sodium in the body, can cause the body to retain fluid. This increases blood pressure. Low potassium levels. Potassium helps balance the amount of salt in the body's cells. A proper balance of potassium is important for good heart health. Low potassium levels may be due to a lack of potassium in the diet or certain health conditions, including dehydration. Drinking too much alcohol. Alcohol use has been linked with increased blood pressure, particularly in men. Stress. High levels of stress can lead to a temporary increase in blood pressure. Stress-related habits such as eating more, using tobacco, or drinking alcohol can lead to further increases in blood pressure. Certain chronic conditions. Kidney disease, diabetes, and sleep apnea are some of the conditions that can lead to high blood pressure. And pregnancy. Sometimes pregnancy causes high blood pressure. Complications of hypertension are due to the excessive pressure on the artery walls that can damage blood vessels and body organs. The higher the blood pressure, and the longer it goes uncontrolled, the greater the damage. Uncontrolled high blood pressure can lead to complications including heart attack or stroke. Hardening and thickening of the arteries due to high blood pressure or other factors can lead to a heart attack, stroke, or other complications. Aneurysm. Increased blood pressure can cause a blood vessel to weaken and bulge, forming an aneurysm. If an aneurysm ruptures, it can be life-threatening. Heart failure. When you have high blood pressure, the heart has to work harder to pump blood. The strain causes the walls of the heart's pumping chamber to thicken. This condition is called left ventricular hypertrophy. Eventually, the heart can't pump enough blood to meet the body's needs, causing heart failure. Kidney problems. High blood pressure can cause the blood vessels in the kidneys to become narrow or weak. This can lead to kidney damage. Eye problems. Increased blood pressure can cause thickened, narrowed, or torn blood vessels in the eyes. This can result in vision loss. Metabolic syndrome. This syndrome is a group of disorders of the body's metabolism. It involves the irregular breakdown of sugar, also called glucose. The syndrome includes increased waist size, high triglycerides, decreased high-density lipoprotein, HDL or good cholesterol, high blood pressure, and high blood sugar levels. These conditions make you more likely to develop diabetes, heart disease, and stroke. Changes with memory or understanding. Uncontrolled high blood pressure may affect the ability to think, remember, and learn. And dementia. Narrowed or blocked arteries can limit blood flow to the brain. This can cause a certain type of dementia called vascular dementia. A stroke that interrupts blood flow to the brain also can cause vascular dementia. Blood pressure screening is an important part of general health care. How often you should get your blood pressure checked depends on your age and overall health. Ask your provider for a blood pressure reading at least every 2 years starting at age 18. If you're age 40 or older, or you're 18 to 39 with a high risk of high blood pressure, ask for a blood pressure check every year. Your care provider will likely recommend more frequent readings if you have high blood pressure or other risk factors for heart disease.